this is Sayeda Sabakatami. I wanted to do the head to toe assessment, but before that one, I wanted to do the room screening, and then we just moving, so we have a little bit boxes, but I'm gonna be started to room screening. Those are my stuff. There's no earring pots. This is my paper. Before I'm starting to do things, I'm gonna be write it down. And this is my pen. Okay, give me a second. Okay, I'm gonna be starting. First of all, I before we do this video, I already get the consent of the patients, but I will talk about that with the patient as well. So, hello, this is Sayeda Sabokatami. I'm gonna be your FMP today. The reason I'm bringing you here is because I wanted to do head-to-toe assessment on you, and regarding this matter, I'm gonna be taping this video and also saving this video in the YouTube for my professor to see.
Sure.
Do you give me a consent?
Yes.
Perfect. So, shift complaint means what is the reason you coming to any like doctor appointment or FNP. So, what is your shift complaint today? You're here. What I'm gonna be doing on you? Do you know that?
It is a head to toe test for my whole body.
Awesome, perfect. Thank you so much. So, before me starting, I want to ask your name, your date of birth, your race, your nationality, and are you consider you male or female?
My name is Benjamin Happy. My date of birth is October 1992. I am a man, and then my race is white or Caucasian. What else was the question?
Where were you born?
I was born in Iran, Tehran.
Are you citizen?
I am not. I'm a permanent resident at the United States.
Perfect. What is your occupation?
I'm a PhD student, PhD candidate.
Perfect. Are you single or married?
I'm married.
Are you living alone or with your wife?
I live with my wife.
Perfect. Are you living in an apartment or a house?
I live in an apartment.
Perfect. Do you feel safe at your home?
Yes.
Perfect. Do you have any gun or pools at your home?
No.
Do you wearing seat belts when you're driving?
Yes.
Perfect. Do you feeling any anxiety or any depression?
No.
Perfect. So, do you do exercise during the week?
I try to do twice or 3 times a
Perfect.
week.
What kind of diet are you following?
I usually don't pay that much attention to my diet, but I try to eat healthy as much as I
Okay, so like for example, are you following Mediterranean, ketosis? Which one? Like
can. Mediterranean.
Mediterranean, perfect. And do you drinking plenty of water?
Yes.
So we recommend what? How many water do you
Like
drink?
8 cups of water.
8 cups of water, perfect. So my other question is, have you ever been in a hospital?
No.
Never been in a hospital. Have you ever had any surgery?
No.
Have you ever had infection like a TB or HIV?
No.
Okay. Are you sexual active?
No.
You don't have sex with your wife?
Ah, okay. I didn't get your question. Yes, I have.
Perfect. What kind of protection do you use?
Condom. Usually.
Perfect. Thank you. Are you have a mono or a couple a partner? Like do you have
just one partner.
Just one partner. Perfect. So my other question is, have you ever had surgery?
No.
Have you said you never been in a hospital?
No.
Am I right?
No.
Perfect. So shift complaint on the patient, as he mentioned, it's patients here because of the head to toe exams. But if patient have any problem, like coming with any pain, we're gonna be use the acronym of OLD card, which is onset, location, duration, characterized, um, aggressive or aggravation or relief in, and also the timing, to see what's the patient's problem. So since patient doesn't have any problem and the shift complaint is just head to toe or annual exam. When was the last time you have eye exam?
It was last year.
When was so we recommend this every 6 months,
Mhm.
okay? When was the last time you have a teeth exams?
Also about a year ago.
So we're recommending every 6 months. Are you updating with your immunization, like a child immunization vaccination?
Yes.
And COVID?
Yes.
And flu vaccine?
Yes.
Perfect. Thank you so much. So my other question, have you ever felt depression or anxiety?
No.
Have you ever been in a hospital because of depression and anxiety?
No.
Do you have any allergy to any medication, environment, or food?
No.
If the patient have any allergy, I'm gonna be asked what kind of allergy, what kind of reaction patient have it, and what is aggressive and how they deal with that. Do you take any medications?
No.
If the patient taking any medication, I'm gonna be asked about what kind of medication, how many dose, how many milligrams are they able to taking, and what is the reason they taking. Do you take any vitamins or herbal supplements?
Yes, I get the vitamin D,
Mm-hmm.
D3, 2000 DUI, I believe, and then just
Just the
hertamine. That's it.
Just the regular vitamin.
Just regular.
Perfect.
Okay.
So we pretended the patient said no, but as he know what he taking, so we asking, like he explained what he taking. But if patient doesn't know, if the patient's going to any pharmacy, we can pull up the pharmacy and looking what they're taking, or we usually ask the patient on the first appointment to bring it what their medication they take it. Okay. So my other question is, so have you ever think about to kill yourself?
No.
Okay, perfect. Have you ever had any psychiatric issue?
No.
And because of that, you stay in a hospital?
No.
Do you use any tobacco?
No.
Or alcohol?
Alcohol, not regularly, but once a month.
Once a month. What about illegal drug?
No.
Over even prescription drugs?
No.
Okay, so as we see patient, answer honestly, but in purpose of this video, we pretend patient said no to drinking alcohol and everything, but that's a good because patient can tell me how much a drink they usually take, and we're gonna be asked the patient what kind of drink they are drinking, how many times a week, and those the information we're gonna be asked the patient. Okay, perfect. So do you have any siblings?
No.
So does your mom and your dad alive?
Yes.
Perfect. What about your grandparents, your grandma, granddad from your dad's side?
No.
What about your grandpa and grandma from your mom's side? No. Okay, why they are die in both sides?
Like because of natural.
Natural causes?
Yeah,
Okay.
natural.
Do you know what age they are approximately, your mom's side and your dad's side?
My mom's side, they were around 80 years
Uh-huh.
old, and
Perfect.
dad's side, 9 years old.
90 years. Okay, perfect. But your parents are alive.
Yes.
Perfect. So I'm gonna be starting to asking a couple questions regarding your parents. Okay. Before that, do you have any children?
No.
Okay, perfect. So I'm gonna be start to asking a couple questions, but during that question, I'm gonna be asked if your mom or your dad have those problems, like those problems. Okay, first of all, my patient's wearing glass, so he had a glass always, but we pretended he doesn't have any glass and he doesn't have any eye problems. So my question is, does your mom or your dad ever have glaucoma or cataract?
No.
So, and you wearing glass, but we pretend the patient doesn't wear glass or any eye contact. Do you ever have any chest pain?
No.
Okay, how about your parents? Does they have any hypertension or hyperlipidemia or any cardiac problem?
No.
Heart problem. Perfect. Do you wearing any hearing aids?
No.
What about your parents? Does they wearing any hearing
No.
aids? Okay, perfect. Do you have any breathing issue?
No.
Does your parents have COPD or asthma?
No.
Perfect. So do you have cyanosis?
No.
Do you have any headache, like migraine, or any anxiety?
No.
What about your parents? Does they have any anxiety or depression?
No.
Does your parents ever have, I said asthma and, okay, do they have any endocrine problems such as diabetes or thyroid?
No.
Do you have diabetes or thyroid? And I'm asking about your mom and dad, so you answer me for both sides.
Yes.
Okay.
No.
Do you feeling any joint pain or any muscle pain?
No.
What about your mom and dad? Do they have any muscle atrophy or any arthritis?
No.
Okay. Do you have any? Have you ever had any cancer?
No.
What about your parents, like breast cancer or liver cancer?
No.
No. Do you have any blood problems such as factor VIII or anemia?
No.
So what about your parents?
No. They didn't.
Perfect. Do they have any depression or anxiety?
No.
Do they have or you have ever have a diagnosis with schizophrenia or depression?
No.
Or Alzheimer?
No.
What about your parents?
No.
Never? Okay. What about a kidney problem like kidney stone or UTI? Do you ever have it?
No.
What about your mom and dad?
No.
Never? Perfect. Do you have any genetic issues such as Hashimoto's or a sickle cell?
No.
Okay. Does your what about you?
No.
Parents? No. Okay. Does your parents drinking alcohol, using tobacco or illegal drugs?
No.
Do they have any allergy?
No.
To medication, foods, or environment?
No, I don't.
No. Okay. What about you?
No.
Okay, perfect. I'm asking about that one. Okay, so my question is, as you mentioned, you have a partner. So my other question: have you ever do the breast exam on yourself?
Myself?
Yes.
No.
Okay, so for the guys, we usually recommendation to you guys do it the breast exam same as the woman because the tissue are the same, just the shape is different. We want every month you do it, you touching and any abnormal, like if it's tender or if it's you finding any nodule, discoloration or discharge, we want it. So also if my patient was a woman, I will be asked the same. Also, since my patient is a guy, but if it's a woman, I'm gonna be asked about when was the last menstrual cycle? How's the characterized? Like how do they have cramping, pain? Are they taking any medication during that? Are they menopause? If the menopause, when was it started? And also, have they ever have any pregnancy? And then I'm gonna be asked how many like live children, died children, unsuccessful pregnancy. I will ask about those as well. So my other question, my other recommendation usually for the guys is do the testicle test every month in the shower with their thumb and the middle finger and touch it to find it any nodules, any tenderness, any like atrophy if they find it. So and if you find it any problem, so I want you to follow up with your primary doctors. Okay. So let me see if I'm asking everything. I'm asking about the head. Do you wearing any denture?
No.
So what about your mom and dad?
No.
Okay, perfect. So My patients walk normally to the office, and like we printed here is the office. Patients are. So do you know where are you?
And we are at home.
Do you know what year is that?
It is 2024.
Perfect. So patient alert and oriented times 4. I'm looking at the patient. Patients have on an appearance. I inspected. There is no jaundice, no cyanosis, no pallor. So the patient has a hair on the head and also on the hands and also on the legs. The hairs is distributing equally, and the cephalic seems symmetric. Neck is symmetric, nose is symmetric. I don't see any ptosis. I don't see any nystagmus right now, not yet. So I look at it, I don't see any patchy hair, any alopecia. If I don't see any shiny skin, which is, if it's the shiniest skin, I would inspect it doesn't have the good circulation. I don't, can I have your hands? I don't see it any clubbing fingers or cyanosis. Clubbing fingers usually is indicated for the COPD. Also, I don't inspecting any lesion, any maculae, any pustules, any varicose vein, and I don't see it any wounds, any tattoos, any discoloration. So what I wanted to do before I'm gonna be do it, so I know the patient's height and weight. The height of the patient was 5'11", and the weight of the patient is 190. So the BMI of the patient is 28. And also I do the heart rate. The heart rate is on the 87. Patient respiration is 18. Patient saturation, oxygen saturation 199. Blood pressure was on a 12/8. Do you have any pain?
No.
Okay, patients doesn't have the pain. And I do all those exams on the patients. I do heart rate, temperature. Patient temperature was 37 centigrade, which it doesn't have any fever. Okay, so now I'm gonna be started. I'm gonna be turning a little bit of my cameras here. So as I mentioned, I don't see it any lesions, so I'm gonna be touch the patients. I don't feel it any temperature or any problem on the patient's temperature. I'm touching. I'm sorry. I'm gonna be use the sanitizer, and I'm gonna be start to touching the head. I don't see any asymmetric, no tender. Do you feel it any pain when I touch it? Okay. I don't feel like any tenderness. The patient doesn't feel any tenderness. I don't feel it any depression on the patient's head. I look at his face. There is no jaundice, no cyanosis, no pallor. So can you lift your eyebrows up? Okay. Can you give me a big smile? Can you puff your cheek?
What does it mean? Oh.
Like this? Perfect. Thank you so much. So I see it, as I mentioned, patient doesn't have ptosis. I checking the cranial nerve, the facial cranial nerve, and also the upper cranial nerve of the 5 and down. So both of them are work equally. So I look at it, the patient's eyes sclera, it's white, and I don't see it any anemia. The lacrimal glands are seems patent. It's moist. So on his eyes is pink. I don't see any pallor, so there's no anemia seems on the patients. I don't see any nystagmus. So now I wanted to checking the patient optic nerve. So by the optic nerve, so patient, can you wear your glass?
Yes.
I'm gonna be ask the patient, pretended patient doesn't have a glass or eye contact. So we usually ask the patient, and I wanted to read the in the clinical, we going to the 20 feet. Right now we're 6 feet, but because I don't want to go away from the camera, so I'm gonna be ask the patient, can you read the last line for me?
LTFPH.
Perfect. Can you cover one eye and do again?
LTFPH.
Can you do the other eye for me, please?
LTFPH.
So that's showing the patient has a vision of 20/20. Another test we usually do is accommodation. So accommodation means a patient, if look at it, this objective, and can you look at it, the clock watch on that? So, and I look at it, the eye, can you, okay. So first of all, this is means patient has accommodation, means when they look at it, the closed object is they constriction their eyes, and when they're looking in the far, they dilute it, so they are able to accommodation. Another things is when I shine the light in the patient's eyes, I'm able to see a patient's eyes going from 5 to 3, which means they reaction to the light, both eyes. So I said patient doesn't have nystagmatism, and also, so that's what the cranial nerve 2. I'm going to be check cranial nerve 4, 6, and 3. So 3 is oculomotor, 6 which abducent, and the 4 is circular. So I'm going to be ask you to, can you please follow this? 3, 6, 3, and 4. 3, 6, 3, and 4. Perfect. Patient able to do all of this. Now I'm gonna be, okay, no, you can just leave it. So I'm gonna be bringing my hands, and I want to, whenever you see my hands, you let me know, okay?
I see them. I see them.
Perfect. Thank you so much. Patients are have 180 degrees of visions. Now I wanted to checking the red reflex on the patient eyes. So also when I look at it, patient doesn't have a exophthalmos, which is bulging eye, which is one of the diseases patient maybe have it. So I'm going to be check the red reflex on the patients. And other things I want to double check it on the patients is make sure patient, first of all, patient have the red reflex, and the other one is I'm going to be checking no wool spot, no no bulging eye, I check it. No nystagmatism, I check it. The vein is usually bigger than the arteries. No hemorrhage, no volar spot. I wanted to see a macula and fova. I wanted to see optic disc, which is orange yellowish color, and I want to make sure all the nerves are patent and I'm able to see it. Those. So for the, because I'm checking the left side, so I'm holding the machine on the left, and for safety going this, I can see the red reflex. Perfect. I see optic, I see fova, I see all those I mentioned. For the right one, I use my right hand, and for the safety of the patient, red reflex, I can see all the nerves. Veins are bigger than arteries. Perfect. You said, do you feel it any tenderness?
No.
Okay, perfect. So, do you feel any tender? Can you open your mouth? Okay, thank you. I check in the TMG. Okay, can you please move your jaw right and left for me? Okay, perfect. So I don't see it any GVD as well since I'm here. The next one, I want to check it on the patients. I wanted, so can you breathe in for me? Okay, can you close one of your NARS for me? Okay, the other one. I don't not hearing any problem on the breathing of the patient. Patient before mentioned he doesn't have any breathing problem. So the next one I wanted to do, first of all, I want to ask the patients to close their eyes, and I'm asking to guess what he breathing. It's olfactory, which is cranial 1. Can you close your eyes for me? Can you close one of your left nose? Can you close it with your hand?
Okay.
Perfect. Can you tell me what you smelling?
I think it is what was it? I forgot the name in English. دارچین. چی بود یادم رفت اسمشو. I forgot the name in English actually.
Okay, it's okay. I do have the two things on my hand. One of them is vanilla. One of them is what it called? Oh my god, I forgot it.
Cinnamon. It was
cinnamon.
Okay.
Yes, perfect. Thank you.
Yeah.
Okay, so I wanted to tell me what is this one?
This one is vanilla.
Okay, perfect. Thank you so much. Can you go to the other nose for me?
This one is cinnamon.
Perfect. Thank you so much. I know sometimes it's hard to remember the names. It's okay. Okay, now I wanted to check it inside of the nose of the patient. First of all, I'm checking it's symmetric. Do you feel it any tenderness?
No.
it's I see it's midline. I don't want to see any deviation, any polyps inside of the nose of the patient, any hemorrhage. I don't want to see it, all those things. Okay, for the safety, I put my fingers here. I don't see any polyp, no deviation, no discharge. Perfect. On the other side. No deviation, no hemorrhage, no discharge. Thank you so much. So I'm going to the next step, which is I'm going to the patient mouth. So what I don't see any herpes lesions on the patient lips, no discoloration, no cyanosis. And he said to me he was in it with the dentist about like a year ago. Oh, by the way, I don't see any conjunctivitis on the eyes of the patient as well. Can you open your mouth for me? Okay, I don't see any threshold, palate is intact, salivia was patent, pilar distributing equally. I don't see it any gingivitis. Can you bring in your tongues out for me? Please tell ah. I see it oval is uvula. It's on the midline. I see the tonsil was +1. I don't see any inflammation. Also, I don't see any abscess on the patient teeth. I already checked his vagus nerve. Also, hypoglycia, which is a cranial nerve 9 and 10. Okay, can you move your tongue in here? Perfect. On this side, perfect. I already checked the cranial nerve 12 as well, which is a hypoglycial. So patients are able to do it. Now I'm going to the neck part. Patient neck is midline, and no lesion, no tattoos, no wounds on the patient. I'm gonna be touch it. I don't feel it any tenderness. I don't feel it any inflammation, any nodules. Do you feel it any tenderness?
No.
Perfect. Can you sit a little bit there?
Yes, sure.
Awesome. Thank you. Not really far. I want you put your back here, like
Oh, okay.
So coming. Okay. So I'm gonna be touching for the patient's thyroid. Can you swallowing your salivia? Thank you so much. Patient thyroid was intact. I don't see it. I cannot see it any border on the inflammation on the thyroid issue of the patient. Thank you so much. Can you see it right here?
Sure.
Now I wanted to check it. The patient's lymph nodes, preocular tonsils, postocular, submental, submandibular, anterior cervical, posterior cervical, occipital, and subclavicle. I don't see it any inflammation, and I don't feel it then. So which means they are intact, patent, working great. Patient doesn't have any infection. The next exams I wanted to do it. I wanted to check it patient hearings. So first of all, we know patient it's a cranial nerve 8, which is the vestibular, and the first things I want to look at it extra outer canal. So I don't see any lesion. I don't see any cyanosis. I'm touching. Do you feel it? Any pain or any tenderness? No. Okay. I don't see any discharge. I don't see any hemorrhage. I wanted to check a couple things. So on the clinical side, we're going all the way in the back of the patient. I'm gonna be asked the patient to tell me what they're hearing. Since I'm here, can you go a little bit over there? Thank you. Okay. So I'm gonna be close this one, and I'm saying three words, and you repeating for me. Okay.
3AB.
Perfect. And the other one?
5AB.
Perfect. Patients are able to hearing both of them. So on the clinical, when we checking the babies or kids, we usually pull the ears back and down. For an adult, we pull up and back. On the patients, what I don't want it to see any hemorrhage, any extra discharge. I wanted to see the cone of light, which is on the left side. It's usually at on the left side, it's at the 7 o'clock, and on the right side, it's at 5 o'clock. And I wanted to see a timpani. It's gray. So now I'm gonna pull up and back. No hemorrhage, no hemorrhage, no extra discharge, cone of light. It's on the 7 o'clock, timpani is gray, and I don't see any hemorrhage. Can you please sit right here? Thank you so much. Again, pull up and back for the safety. Timpani gray, no discharge, cone of lights is on the 5 o'clock. Perfect, thank you so much. Now what I wanted to do, I wanted to testing the Weber running, and also I wanted to, we know air conduction is faster than the bone conduction, so that's what we wanted to test. So do you feel it
Yes.
equal in the both
Equal,
ears, or
yes.
one is stronger than the
Equal.
other one? Perfect, that's a Weber test. Okay, can you come in a little bit forward? Thank you. Can you feel it on your mastoid bone?
And very little.
Yes, awesome,
Yeah.
perfect. And again, when you don't hear it,
I
can you
hear
let
it.
me?
Yeah, I hear
Okay,
it.
perfect. Can you feel it?
No. I hear it. No, not now.
Okay. Can you hear it?
Yeah, now
Okay,
it's stopped.
perfect.
I was hearing it.
Yes,
stopped.
awesome. So thank you. You can see it. Okay. So I'm patient. I check it the Weber and running test, and we know ear, ear conduction faster than the bone conduction. Okay. So and the last one is a cranial nerve 11, which is we checking the triples muscles and sternocleidomastoid mastoid. Can you please move your up and down? Perfect. 11 cranial nerve is working as well. Next one, I want to touch the patients for the deltoid, biceps, triceps, epicondyls. I'm checking for any tender. Do you feel it any tender?
No.
Any pain?
No.
I'm checking the wrist. Also, I'm checking the capital should less than 3 seconds. I'm checking the distal, proximal, and metacarpal. I do both sides of the hand. I don't feel it any tenderness. I'm gonna be check the pulses right here, make a pulse, radial pulse, perfect. On the neck, on a cardiac pulse, I don't see any GVD on the patient. We do one by one, but on the rest of the body, we do both sides. So I want to check my time. Okay, perfect. So now I'm going to go to the rest. So for the patient's privacy, we don't ask the patients to remove their clothes, but I'm going to be checking the chest of the patient. I don't want to see any lifting, any hives. I'm going to be checking for any tenderness. I'm asking the patient if they feel it, any tenderness. Also in here, I'm checking for the lymph nodes here as well. Also, I see the sternum is in a midline. I don't see it any evactome or carcinotome on the patient's midline. Now I wanted to listen to the patient hearing. So for the hearing, I don't want to hear any wheezing, any crackle, any absent hearing. So I'm going to be hearing on the 8th part on the patient. Can you breathe in for me whenever you feel it? Awesome. Awesome, thank you. Now I'm gonna be percussing. So we wanted to, I'm hearing the resonance, not the timpani, because timpani means I do on the patient, can you lift up, on the patient bones. The other one, can you stand up for me, please? Thank you. Now, can you say 99 for me? Say 99.
99, 99, 99, 99, 99, 99.
Perfect. Can you go back after this one? Tell 99 again.
99, 99, 99, 99, 99, 99.
Perfect. I don't see it in discoloration. Now, on the back of the patient, also, I want to listen to the 8th place for the hearing. Sorry, not the hearing. long sound, breathing pattern, since I'm here, so we want to checking the diaphragm exclusion. So can you please exhale for me? Breathing and breathing out all the way and keep it right here. So no, just exhale. Breathing, wait, couple minutes. Okay, and now breathing for me. Breathing in. No, one more time, sorry. Can you exhale? Okay, and can you breathing in? Okay, thank you. So for the patients in a clinical setting, we usually in the both side, right side and the left side, we on exclusion we want it to be the diaphragm going on between 3 to 5.5 on the both side. So that's we do right side and the left side. Okay, can you can you breathe in for me? Okay, can you go back? Can you breathe in one more time? Okay. I see a patient diaphragm going up and down equally. Perfect. Okay, can you sit for me? Thank you. So for the heart, so our patient said that he doesn't have any heart issues. So what I'm gonna be doing, I'm gonna be listening to the patient's heart, sit and lay down as well. So I'm gonna be checking right second intercostal, which is aortic. Second intercostal on the left side, which is pulmonic. Third intercostal, which is herbs. Fourth intercostal, which is tricuspid. And fifth intercostal, which is we checking PMI as a epical, which is the strongest sound of the heart we can hear it. So we don't want to hear it any S4, S3, and non splitting of the S2. And I'm gonna be checking all of that. No, you can do normal breathing. Yes, thank you. Okay, perfect. I do with the diaphragm and the bell, both of them. So here, here, and here. Also, I'm listening here as well with the diaphragm and the bell, both sides. Okay, perfect. Can you lay down for me?
Yes.
Let me put the pillow right here. You can lay down right here.
Okay.
Put your head here. Thank you. Awesome. Again, aortic, pulmonic, herbs, tricuspid, and apical. Awesome. And other things, I don't see it any highs or any lifting on the patient chest area. I'm gonna be also touching it. Perfect. So if we want to check in the PMI, we can ask the patient to lay on their left side and be checking on that. Since the patient is already laid down, so I'm gonna be listening for the aortic with the bell and with the diaphragm. Also for iliac with the bell, with the diaphragm, with the bell, with the diaphragm. For the kidney one, with the bell, with the diaphragm, with the bell, with the diaphragm. Iliac, I think. So, and also for the femoral, with the bell, with the diaphragm, with the bell, with the diaphragm. Also, we're gonna be checking the patient's femoral pulses as well with the bell and diaphragm as well. We don't want to see any thrill. We don't want to hear any thrill, and all of them are patent and normal sounding. So now I'm gonna be go on the patient's stomach area. So the stomach is flat. When was the last time you had a bowel movement?
It was, I think, today's morning.
Today morning. And on the urination, have you ever felt any like when you go to the urine, do you feel any pain?
No.
No? Okay. So I wanted to check it and listen to it. It's flat. I don't see any jaundice. I don't see any inflammation. No tattoos. No discoloration. I wanted to start to listen to the patient's belly, right from the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Awesome. Now I'm gonna be checking the tympani, right lower, right upper, left downer. Now I'm do palpation first, light, then deeper. Do you feel any tender?
No.
When I'm touching? Perfect. So right now, if I wanted to check it, the patient spleen. Sorry, can you move your legs a little bit? I just wanted to sit it right here. So if I want to check it, the spleen, so it's usually on the 12 ribs, and we cannot tell when we percuss it. We should not be hearing it because it means patient spleen doesn't inflammate, which is the normal finding. On the right side, right upper quadrant, so I'm gonna be from the 12 ribs, I'm gonna be percussive and I'm gonna be feeling the tympani sounds because that means I found the liver. I'm gonna be palpated and try to find the edge of the liver, and I find it and it's a border. I can find it and it's no inflammation or no tenderness. I can see on that area. Okay, I'm so sorry. Can you stand up for me for a second, please? Also, can you do your back, please? I wanted to do the CVA percussion as well. Okay, awesome. Thank you. Can you sit for me? Yes, please. So I do all of that. Firmities. I do that one. I check the fingers. Okay, now I do the stomach. Now on the legs, I'm gonna be touching for any tenderness. Fingers, I'm checking I'm checking the osseous and also Brinken's reactions. Usually it's happened for the babies. I'm checking the knees, ankles. Do you feel any tenderness?
No.
Okay, perfect. Bless you. So also on the back of the knees, the pupils, I'm checking for the pulses, posterior tibia, and also on the patient's another one which is here. I forgot the name. On the back of the patient fossa, also I'm looking for the Barkin sign, and it's negative. I couldn't feel it, so I don't see any tenderness. Toes of the patient, and also the good things about the patient posture is straight. I don't see any asymmetric and hands and everything's are asymmetric. I don't see any wounds, any lesion, any papula, any varicose vein, as I mentioned before, and I don't feel it any plantar fasciitis. Okay, perfect. The next ones I wanted to check. I checked all this. Let me see. Tympani, tonsils. I checked the tonsils, fossa, posterior tibia, head. Epicondyle iliac. Okay, so I guess I'm done with this area. Now, okay, can you stand up for me?
Yes.
So I'm checking the. I don't see it any kyphosis, any lordosis. Can you bend for me, please? I don't see it any abnormal. I forgot the name. Any abnormal on the vertebra of the patient. Scoliosis. Perfect. Scoliosis. Thank you so much. Can you stand up? I see the hip bones is in the right place. Sacrum is in the right place. I don't feel it. Do you feel it any tender?
No.
I don't feel it any inflammation. The gluteal in the right place. Also, the lower part of the gluteal. Usually we checking on the gown of the patient, and I don't see it. No abnormal folding and no discoloration. Now, what I wanted to you do, so I wanted you follow my things. Okay, can you do your fingers like this? Can you open it? Can you close it? Can you do with your toes? Open it, close it. Abduction, abduction. Again on the other leg. Okay, perfect. Your hands again right here. Can you do supine, prone. Can you do extension, extending? Okay, can you go up? Can you go all the way up, back? Perfect. Can you go on your back of your head, on your back of, yes, perfect. Okay, can you turn yourself to the right, turn yourself to the left? Can you do extension? You're down, right, left, perfect. And can you do right? Can you do left? Okay, can you go coming all the way back? No,
Okay.
Can you go all the way down? Perfect. Okay, can you do your down? Up. Perfect. Do circle. Perfect. Can you do knee? Perfect. Out. Perfect. Again on this one. Now, up, inward, outward. Do like this, like that. Perfect. Your knees out, knees in. Perfect. You're all the way up, all the way back. Sorry, all the way back. The other legs, all the way in, all the way out. Perfect. Can you please sit? I'm gonna be checking the patient reflection as well. So I'm gonna be do biceps, triceps, again on this hand, biceps, triceps, on curved pose. Okay, perfect on the legs. Awesome. On the ankles. Perfect. Okay, can you lay on your stomach for me? Yes, please. Awesome. Okay, can you bring it your legs, no, legs up? Awesome. And do it by yourself. Do it up. Awesome. Again on this one, up, and do it by yourself. Perfect. I do that one as well. What else? What else are there? So can you stand up for me? Okay. So can you can you yes, do it like this. Okay, so let me push it, push again me. Okay, push again me. Okay, do down, do up, do shoulders up, do shoulders down. Okay, try to push my hand, push with your hand. Patient, strongest 5 out of 5. Can you sit for me? Can you push it up? Push it, my hand, push it back, push it down, push it up. Good. Okay. The next one, I wanted to check in your sensation. Okay. This is a soft. This is sharp. Okay. Close your eyes and tell me what you're feeling.
Sharp, soft, sharp, soft, soft, sharp, soft, sharp, soft, sharp, soft, sharp, soft, sharp, soft, sharp, 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 soft, sharp, soft, sharp, sharp, soft, sharp.
Perfect. The patient sensation is intact. Okay, 1 second. I want to make sure I cover everything. I check in your ears, your eyes, your heart sounds, laying and back. I checking your pulsation, your skin. I do all the exercise. I checking the pulses. I do the stomach. I talking about the highs, femoris. I did it. I do toes. So fingers, toes also capri fill less than 3 seconds. I check it. Sorry, I want to check the time. So I still have time. So epicondyle, I check it. I check it your muscles, trapezius. I listen to your stomach. I listen the lungs, front and back. Um, you do 99. I do. I asked about illegal drugs. I told it. Tonsilline, spleen, palpital. I checked your race, nationality, alcohol fingers, metacarpal. Okay. Do you have a migraine?
No.
Okay. So, um, your chest is symmetric. Okay. I guess that's all I did. Thank you so much. Appreciate that.